All right, ladies and gentlemen, it's time now for the health base. What? Coming in to Dr. Brown. Stay tuned here at WBOE.
All right. Thank you for that introduction. As always, it's always good to get a chance to chat with the folks at WVOE. We always appreciate that. It's another glorious day out here. So, good afternoon, listeners. You're locked into WVOE, the voice of Ebony, where your health is our heartbeat. I'm your host, Dr. Christopher Brown, president and founder of PressureMD Academy, welcoming you to another enriching session of Health Facts, the show where wisdom meets wellness and knowledge is always in season. All right. So we're getting ready for another one of our shows, and we're going to be continuing. This is going to be part two of what we decided to discuss last week, which is basically talking a little bit about insurance and accessing healthcare or healthcare coverage, because there's a lot of things going on in the country right now, and of course everybody's confused, everybody's concerned, and so last week we touched a little bit about some of why we have insurance and how that plays a role in healthcare in America. Touched a little bit about the Affordable Care Act, just kind of briefly, and just so today we're going to talk a little bit more so about hey, so if you have insurance or you don't have insurance, how can you access healthcare? Okay, because there are a lot of nuances in our healthcare, in American healthcare, that gives you options. Maybe not the most ideal options, however, like I said, do give you some options to get access to healthcare while everything else is being sorted out, basically. And as usual, I like to give my disclaimers. Okay, so of course I'm a doctor, but not your doctor, unless you actually come to my clinic or see me on telemedicine. So of course, anything that's in here is mostly for education, entertainment purposes. If you have any health issues, you want to make sure that you're getting that taken care of by a doctor that you're seeing and that you're establishing with. Okay, so that's one thing. Number two, in regards to insurance, I'm not any sort of insurance expert. However, of course, I got my own insurance, and of course, as a doctor, we get patients come to us with issues with insurance because sometimes I'll order things, the insurance company doesn't want to cover it, or people might come in and have some conditions but they don't have insurance. So of course we have to learn a little bit about it. So kind of touch on it, but of course not an expert. You always want to talk to an insurance broker. It's probably is someone that would be knowledgeable about the different insurances and stuff of that nature. And so that's why we want to make sure I give that disclaimer out there in order that everyone can understand, where I'm coming from. A lot of times on social, especially, so I know some people listen on the radio, but others on social media. And of course, a lot of times some people will come on there and, make it seem like, their information is flawless. I always tell people, anything that you're hearing, of course, if it comes from an expert, it's always good, but it's always good to kind of write things down and ask other people, even for experts. Like with physicians, there's things called second opinions. So you can get a diagnosis and a treatment plan. You can always go to another person for a second opinion, just to kind of make sure that that first opinion is kind of in line and reasonable. Same thing for insurances. So if someone says, "Oh, I don't have insurance, I can't go to the doctor," you always want to chat with someone else to say, "Hey, they might say, "Oh, no, you can access healthcare in a different way." So that's kind of what this is for, and so you can understand a little bit about what options are out there for people, and understand and at least get a bit of a sense of why healthcare in the U.S. is so complicated and controversial. Okay, so and I know when I took a class during my public health class, because a lot of people like you saying, "Oh, American healthcare system, American healthcare system." One of the first things that they taught us was that America doesn't have a healthcare system. It has healthcare, but systems are things like the VA. So we have healthcare systems within American healthcare, but not the whole thing is not a system. So like things like the VA is a system. So you go to VA in California versus North Carolina, they're designed to talk to each other. Like I said, that same insurance is going to work on one place versus the other, ideally, I guess. And so you should, technically speaking, you're supposed to be able to pull up records from the California VA and the North Carolina VA. I know I used to work at the VA, and like I said, so that was there, and it may be a little cumbersome, but like I said, technically speaking, that's what's going on. Whereas in America, like I said, there might be two hospitals in the same city, but none of them actually talk to each other. Until recently, now sometimes they have that same healthcare systems or what we call EHRs, and so they can communicate. So that's kind of a long, long way around why some of this stuff about healthcare in America is kind of complicated. Okay, so when it comes to healthcare and in the U.S., we have what we call a multi-payer system. Okay, and so when I say multi-payer, that means that the healthcare is being paid for by more than one entity. Okay. So the one that most people are familiar with is what we call private insurance. And of course, most people access this through employer based plans, but you can also get individual based plans as well. And so, for your employer, so we'll go with the employer based plan. So what happened with the employer based plan is that, the insurance company, and we'll just say Blue Cross because I think that's something a lot of people are familiar with, will have a plan um, for their insurance, and the employer and the private insurance will kind of contract and come up with a premium, and that's what you pay every month, and what is covered, like I said, your primary care, hospital stuff of nature. And long story short, what happens is that basically while you're there, that your employer will give you the option of signing up for that insurance plan, and you'll pay a premium, but your premium is actually discounted because the employer pays part of the premium. And this is this is what I think most people are familiar with. This is private insurance based model. And of course, one of the things about it is that those premiums go up, and so both the employee and the employer are paying it, and that becomes an issue sometimes because, of course, it's taken from the bottom line of the employer, and of course, for the employee, it takes away from what you can take home. Okay, but that's what most people are familiar with. Of course, you sign up for the private insurance, you get the card, take the card to your doctor, and your doctor will bill that insurance company and pay the doctor. Now, a lot of times they'll have like co-pays or co-pays or deductibles where you have to pay, even though you pay that premium to get the healthcare insurance. Even when you go to a doctor, or you go to get labs, or you go to get some imaging, you still may have to pay a portion, what they call a copay, and that could be $5, it could be $50. So it's whatever set up there. So that's what goes on there. So that's kind of what a lot of people are familiar with. So that's private insurance. Then you have government programs, which are programs such as Medicare, Medicaid, and even the VA, because the VA is its own system there, right? So Medicare and Medicaid. So Medicaid is what's known as insurance for the poor, for lack of a better word, kind of simplifying that. But Medicaid is insurance for the poor, where and certain populations and it's usually handled on a state level. So like there'll be a North Carolina Medicaid, there'll be a South Carolina Medicaid, there'll be a Washington State Medicaid, and but a lot of times that funding is mixed between state level and then federal level funds. Medicare, I think everybody knows about that one. That's for the elderly and some disabilities as well, but primarily known as for the insurance you get when you turn 65. Okay, so that's a government backed plan, and so that pays for care as well. Less known ways to access healthcare or how healthcare is financed is what we call out-of-pocket spending, which means you can take your money, go to a doctor or a medical practice, and you just pay directly. You ain't got no insurance, you ain't got no Medicare, you ain't got no Medicaid. You just go and pay for it. Okay, so sometimes it's you just pay what we call a la carte. So hey, look, I stubbed my toe. And so you go in there and like I said, hey, and there'll be menu, it might be a menu or something like a menu, and they say, "Hey, stub toe, I'll see somebody with a stub toe for $50." And so you pay $50, they'll see your stub toe, take care of that, and keep moving. This actually is a way that some countries that's how you access healthcare. Like I said, you literally you really have to put your money up front before you get care. So that is an option out there. It's out of pocket spending, and then there's charity or safety net programs, and so those are like what we call free clinics. Is probably one of the well known ones. And then there are these things called FQHCs as well. So those are out there also. So so that's kind of how kind of a broad overview of how healthcare is financed in the U.S. Like I said, it's a little complicated because you're always trying to figure out like who's paying this bill or whatever. And then sometimes people are like, well, I got insurance, but I still got to pay out of pocket. It doesn't make any sense. But like that's the nature of this. It's a very complex thing. Okay. So now touch a little bit about what the clinician or provider that the term is providers for insurance companies. We all negotiate contracts with insurance, and it kind of determines what services are covered, what services are going to cost, how much the insurer will pay, and how much is the patient's responsibility. Co-pay, co-insurance, deductibles, kind of what we touched on before. Okay. Okay. Now, one of the things that is probably the most confusing, and the thing that causes so much angst and paying for medical care in the United States of America is this method, I guess, for lack of a better word, where you get a bill and this bill has prices on it that just seem astronomical. It's like, these bills are just crazy, right? And then you take it to your docs and they bring it and like say, man, how can you charge, $5,000 to get my stub toe fixed, and this is this is a part of why I want to explain bring this program together because the way it works in the U.S. is that a practice hospital, when they are negotiating with the insurance company, they have it's kind of charge master price or kind of this first charge of what you present to the insurance company. And I know this is not going to make any sense. So it's what you show to the insurance company. Then, as part of that contract, there's a negotiation, and then the insurance company is going to negotiate a lower contracted rate. And like I said, I might put out $5,000 to fix your stub toe, and one insurance company might pay me $5. The other one might pay me, $7.50, and then there might be one that pays me $10. Okay, so yeah, it'll be much the amount that's actually paid or negotiated is much lower than what is on that price, that what they call charge master price for any clinic or anything of this nature. So yeah, so no, the hospital did not get $500 for the aspirin that was given in the ER. So yeah, so that's one thing that I would like for people to know is like, hey, look, there's a charged price, but the hospital entity will only get what's negotiated by the insurers, which will be a much lower contracted rate. So that's one of the things that goes on with people. And what happens also with insurance, if you're doing this with insurance, like I said, as a clinic, I got to charge everybody with this insurance, same price. So that's why everybody gets the same crazy behind price. So now that's for your insurance company. Medicare and Medicaid actually have fixed fee schedules. So for the most part, you can actually look up fee schedules, what we call fee schedule. This is what you get paid for certain services. You can actually look that up online. So Medicare and Medicaid don't do a lot of negotiating there. So they kind of set their fee schedules, and when you get somebody that has one of those Medicare and Medicaid cards, you pretty much know what you're going to get there. Okay. So that's kind of the big, especially for those two big for the private insurance. Like I said, it's you got to give them this big bill, and then they're going to give you what they said they were going to do on your contract. Then for Medicare and Medicaid, most of fixed prices. Now, interestingly, and there actually was a, I think it was a TikTok or one of the doctor that went on social media to show this next thing that almost no one knows about, and that is, say that you don't have insurance, you can get what they call cash pay discounts. Okay. And the cash pay discounts can be kind of like the insurance company, can be significantly lower than what that charge price is. Almost like I said, almost like the insurance company. Like I said, these charge master price are kind of inflated. It's kind of the way the game is worked, the way the game is played, but the actual the rate you receive is much lower. So a lot of times docs will just charge patients the same amount that they get from an insurance company, and sometimes it might be even lower than what they get from the insurance company because they just have to do it consistently for all for uninsured patients. And one of the reasons for the cash pay discounts is that there's a when you deal with insurances, there's a lot of administrative costs that go with us. You got to see the patient, you got to write my note, then you got to write certain codes to send over to the insurance company. The insurance company may reject those, and then I gotta either me or somebody in the office has got to readjust things, send it back to the insurance company, and then maybe the insurance company will pay me, and they may pay me even less than what I thought I was supposed to get. So there's a lot of back and forth, and you need the staff and time and stuff of nature. But if you're a cash payer, and I say, hey, I'll see your stub toe for $5, then guess what? I get my $5. I know what I'm going to get. So because of that, so a lot of times, some of these offices will actually have a cash pay discount where they just kind of charge you a certain rate for certain services because it's just a lot easier to avoid the administrative costs. Also, what happens is that the payments are immediate. So if you're paying me, hey, Dr. Brown, I'm coming in for a stub toe. It looks like you charge $5. Okay, give me your credit card or give me the $5. Okay, write your receipt. You got it. We're done. Okay, you don't have to go back and forth to figure out. You don't have to go back and forth, right? You just pay what you pay, and you get what you get. And then the other thing that happens, this is the other thing that with insurance companies is like, I could take care of you if you got insurance. I can take care of your stub toe, but then turn around and the insurance company still decides that they want to take back some of the funds. So when we talk about the issues that some people have with private insurance companies, some of this stuff is just it kind of defies logic, and so folks don't really understand why a particular practice might drop an insurance company, but some of this stuff kind of goes in there. So this goes into why a patient with insurance may have to pay $600 for, say, an ultrasound, but somebody that comes in with no insurance with just cash may pay $150 for that cash payment. So it's one of the things that I like that, like I said, we want people to know is that, okay, you don't have insurance, but maybe you have a job, or maybe you have a business of some nature, and there's stuff that you need to get done. If you reach out, and I always tell people, this is why I tell people to get primary care docs early, because you can ask around. Like I said, if there's 10 primary care docs in your city, maybe 3 of them take cash, and maybe the other ones don't. But you can chat with the ones that take cash. You can find out what their prices are. You can compare the prices between the ones that take cash. And then you can also find out, hey, in addition to you taking cash, do you know other other services that also take cash? So they may have a connection to labs that take cash. They may have a connection to pharmacies that are willing to give you a cash discount on your medications. And then, like I said, they may have connections that can get you a discount on like imaging and stuff of that nature. So that all this stuff is out there. So this is one of the this is if you don't take away anything else from day, just take away from the fact that just because you don't have insurance doesn't mean you can't access care. Just make sure that you go out and ask, hey, do you all do a cash discount for your health care, and see if they have a list up there. Okay. So this is probably one of the bigger things that I want folks to get out of this. All right. So yeah, okay. So going back, so we got your private insurers. So people that got a job or they bought their private insurance off me, the exchange or something of that nature. And so that's for those people, you got an insurance card. You can access. Take that take that card to your healthcare provider. Of course, you want to make sure that you're what we call in network, because that gets you the best financially the best deal. So you can call your insurance company and say, hey, I need a kidney doctor. What kidney doctors do you have that are in my zip code? You can say, you need a diabetes specialist, you need a primary care doctor. You can actually call your insurance company and find out who is in your area that takes your insurance. Okay, you can do that. Okay. So, but for the most part, you have your insurance. You got certain coverage. You're for at least for the next year, you're set, right? Now that's the people with insurance. Now, for people that don't have insurance and you're not Medicare eligible, because there are certain, when you become Medicare eligible, that means 65 and older, or like say you got a condition or something that you are eligible for Medicare. There are certain rules that apply where it gets harder to do things like cash, because there are because you're eligible for this insurance product. So when we talk about people not having insurance, we talk about basically the non-Medicare eligible population that does not have insurance. Okay. So for those people, we want to chat a little bit, because that might get us, pretty dicey. It's always kind of dicey whenever you don't have insurance. But like I said, we want to talk about, how to navigate healthcare in America to make sure that you still can get access to care, uh, even though it may not be the most usual, something that's usual or something that you're accustomed to. Okay. And so we're going to talk about, pay cash. Number one, pay cash, self-pay, kind of like we said before. Ask the clinic if they have a discounted self-pay rates. As transparent pricing becomes more common, this is probably going to become more common in general. So you want to make sure you ask about that. A lot of times it's cheaper than actually, and some people do it even if they have insurance. They just don't file. You just can't file it with your insurance company, and they sometimes find it cheaper than filing insurance. Okay, so paying cash. So you don't have insurance, you pay cash. Number two, direct primary care. And I think we mentioned this a couple of times before. Direct primary care is most is whenever a primary care doctor decides to not take insurance. Okay, so this doc don't take insurance at all. And when they do that, what they do is they do a membership model. It's kind of like almost like joining a gym. So instead of joining a gym, you join, Dr. Brown's direct primary care. Dr. Brown or any this direct primary care will charge a fee. So it could be 50, it could be 100, it could be 100 and 150, somewhere around there. It could be, every model is different. And you pay that per month. Sometimes of course, you pay it a year up front. And what you get, of course, the details, of course, are different from one primary care to the next. But for the most part, you get unlimited visits, you get direct access, you get no insurance bill. Okay. So you get this unique access to a primary care clinician for the cost of this monthly membership. Okay, a lot of times the direct primary care practices will also have access to medications. They'll have access to labs, and imaging that may be a lot less than the average person can get access to. Okay, so that's direct primary care. Now they do also have direct specialty care, kind of similar model. So, like I said, say you had diabetes and and really you just have diabetes and nothing else, which is pretty rare. So you might want to find a di direct specialist care, direct specialist care, where that person is functioning as a diabetes specialist, and you can same thing. You can pay this certain amount every month, get basically unlimited visits and direct access to care. So this is a model that is growing in popularity. And for people like say you yet again, let's go back to the small business owner. A lot of times, because a lot of times they're the ones that don't have insurance. If you're a small business owner and you find yourself not able to afford, insurance, with private insurance, look into direct primary care. At least this will be good for preventive care and chronic disease management. Of course, if you're in the hospital, most of the time most time they don't go into the hospital per se, but they do provide very good outpatient care. So, and a lot of times sometimes people get direct primary care and what they call a catastrophic insurance plan. That's, it's kind of beyond the scope of this talk, I guess. So we got that going on. So that's direct primary care. We touched a little bit on direct specialty care, both of cash-based subscription models of accessing care. Now, there's concierge medicine, which probably most people know about concierge medicine. Now, these are usually enhanced access. They have an annual fee, longer visits, personalized care, higher costs, but they usually also give you very, very high service levels. So, and sometimes these people will actually still take insurance as well. So, concierge model is just for it's going to be for a select group of people. For the average person, it's probably going to be more direct primary care. But concierge medicine is an option. So maybe you're super rich and you don't want to don't want to buy insurance. So, but you can access care with insurance, medicine, concierge medicine. Sorry about that. Then there are what we call health sharing ministries, and these are groups that share medical expenses. It's not an insurance. It's an interesting, and I actually have an insurance that I sell like this. Well, not insurance, but a cost sharing product that I actually can sell. So feel free to send me a message if you have questions about it. But basically, health sharing ministries are groups that share medical expenses. So this group of individuals, they'll screen you, they'll bring you in, and you'll probably pay a monthly fee. But then if members have issues, they can share it amongst the people that is in their group. So it is something that if you are curious, health sharing ministries or health sharing plans, you can ask about. I would definitely sit down and vet this and make sure you understand the nature of what this is, because it's not an insurance product, so it's totally different than that. So, but it is an option. So, health sharing ministries, health sharing plans. Okay. Other things you can have access to include federally qualified health centers, and these are certain centers, so FQHCs, federally qualified health centers. They tend to have sliding scale fees. So if you make a little bit more, you pay a little bit more. But if you can't make a lot less, you pay a lot less, and sometimes not at all. A lot of times they do primary care, they do dental, and they also have mental health services that are available there. Most of the time, this is available nationwide. You can just look up FQHCs, federally qualified health centers, and find one of those that may be near you. Okay. All right. So next we have free and charitable clinics. These people provide care for uninsured individuals. They're usually run by nonprofits and community groups. When I was in med school, I used to participate and volunteer for one of them. And so, of course, it's kind of rudimentary, but it does provide the care that you need. Sometimes the free clinic will actually get you access to specialists. They tend to, most of them are more for, some of the chronic diseases, some, of course, acute care, but sometimes they'll discover things that are there. So say you need a heart evaluation, and they may have relationships with a heart group that may be willing to either do deeply discounted or sometimes even free care, just depending on what's going on there, what's the relationship you got. So, that's free and charitable health clinics. Then, of course, you got the retail clinics, urgent care. This is like, your CVS or Walgreens or whatever the clinics, they have those minute clinics and stuff of nature. So sometimes now they're going to have transparent pricing, usually limited scope, but like I said, accessible, because you just got to walk in there and take care of whatever you need to take care of. So, you got a stub toe, go in there, they'll have a stub toe fee. You just pay it and keep it going. So you got that option as well. And then of course, we're going to still talk about the ACA marketplace plans because if you're uninsured and that window is open enrollment's there, you can always go apply and see if you qualify for um, for for reduced or premium subsidies. And that's one of the things that people are arguing about is subsidies for these marketplace plans. So that is an option. So because we're running out of time, this is actually taking a lot longer than I would have thought. So not long story short, so like I said, for those individuals that do not have, we talked a little bit about the different uh, ways healthcare is covered or healthcare is paid for in the U.S. We talked a little bit about what the bills mean, like I said, and why your bill is so much higher than what that doctor or that hospital gets paid. And we'll talk a little bit about that. And then we talked about options for people that don't have insurance and are not Medicare eligible. And so when we just run down that real quick, and that is, you have the option to pay cash, just ask for the cash, the discounted self-pay rates. So pay cash, direct primary care, direct primary care, direct primary care. Definitely look into that. So direct primary care, you got direct specialty care, uh, you got concierge. I'm mentioning concierge medicine for those most part. It doesn't work. Then you got the health sharing ministry or health sharing plans. So that's an option for coverage. And then you have the federally qualified health centers, which you can also look up online. They provide sliding scale fees. You got free clinics. Never forget about free clinics because they can provide you with care as well. Then retail clinics, if you really, and urgent care, if you really need just something taken care of real quick. And then, of course, the ACA marketplace plans. You want to take a look at that, see if you qualify for subsidies. If you truly are in a financial bind. Okay, so whew, that's it for the day. That's it for the day. So thank you all for taking your time out of your day to listen to me. If you didn't get a chance to catch it today, the recording is going to be up on YouTube on a YouTube site for PressureMD Academy. So feel free to check that out as well. Also follow us. We appreciate the follows. Make a comment as to whether or not this is useful or not. And outside of that, I think that's pretty much it. Thank you for taking a listen. And we'll kind of call this a day until next week. Everybody take care, and we'll chat with you later.